So if my child has scoliosis, how should they wear their backpack or their purse? This is something called activities of daily living. And essentially what we're saying here is, how can we do the things that this kid does anyway in a way that's going to help them? Like, for example, they carry the backpack, or a lady carries her purse. So we know that the body will respond to the weight that's on it. So for example, if a woman has a purse on her right shoulder, she's not going to let her right shoulder drop. She's going to automatically and unconsciously hike the shoulder so the bag doesn't fall off. And if this is if this is done in the correct way, it's going to push her into correction. So we can use these normal daily activities in ways that benefit them. Not only carrying a bag, but also how should they sit? How should they recline? How should they sleep? What exercise should they do? What kind of shoes should they wear? All these kind of things are brought together in what's called activities of daily living instruction. Thanks for watching. I hope you found all this information helpful. Please subscribe if you'd like to have more information about scoliosis, and don't forget to hit the bell. That'll alert you whenever we publish new information. And if you've got any questions, write them in the comments field, and I'm going to make sure to address them in a future video. Thanks for watching.